All right, time now for a look at other news making headlines across the African continent. The United Nations saying that the conflict in northern Ethiopia's Tigray region is far from over. This is despite a claim by Ethiopian Prime Minister Abey Ahmed that troops from neighbouring Eritrea had withdrawn from the region. Now, the UN says the vast majority of the region's 6 million people have no access to humanitarian assistance. In fact, James Elder is the spokesperson for the United Nations Children's Fund, and he's just returned from Tigray. In fact, he joins us now live from the Kenyan capital of Nairobi this morning. James, thanks very much for your time on the AM report this morning. I mean, the UN reporting systematic rape and sexual violence, that it is so incredibly widespread. I want to just read from one report in the UN. It says women and girls subjected to sexual violence with levels of cruelty beyond comprehension. James, what did you find in your visit to Tigray?
Yeah, hi there. That absolutely, unfortunately, Michelle, rings true to what I saw and what I heard and the testimonies that I was given. You know, conflict, as you mentioned there, has an amazing ability somehow. I might have just lost you.
We still have you, James. Go ahead.
Conflict has that ability to be remarkably cruel to women and girls, but particularly in situations like this where there's no real front line. And that means that women and girls are so frequently much more exposed to conflict than they would be. And you're absolutely right about that sexual violence. It beggars belief, but it is real. I had testimonies of women who were gang raped by multiple soldiers over multiple days, sometimes in front of their children. I spoke to a girl who was 14 who was raped by a soldier. She was 14 and she was sweet and gentle and very brave, Michelle, but she seemed like she was 11 or 12. Now, simply one centre that UNICEF supports, we've seen an average of 3 cases of sexual violence against women and girls reported each day this year, each day. And remembering that's the tip of the iceberg. It's very difficult. Culturally, there's elements of shame to get over. There's a security risk. It's a conflict. There's transport. There's costs. So one thing is very clear. It's happening. It's not decreasing. And perpetrators of sexual violence in a conflict are violators of international law and must be held accountable.
I want to talk more about perpetrators here, James, because what the hospitals that are still functioning in the region, what they tell us is that these rapes are perpetrated by Ethiopian soldiers and by Eritrean troops, which should have already pulled out by now. I mean, the Prime Minister in that region only last month, I think, actually acknowledging the presence of Eritrean troops there, but we know that they have yet to pull out.
Yes, I mean, look, there's two facets there. One is, you know, UNICEF, as you know, Michelle, is impartial. We are an aid organisation, not a political one, but absolute. And those people on the ground who you mentioned giving testimonies, I mean, there are credible sources that you are referring to at hospitals and so on. Again, hospitals are a key issue because many have been damaged, many have been looted. Again, I saw really state-of-the-art facilities in Tigray, you know, very modern, built last year for emergency obstetrics, for malnutrition, accidents, and they had been looted and destroyed, and oxygen machines and beds and so on gone. What's very clear is that any perpetrators of these type of crimes, sexual violence or destruction of health centres, again, authorities need to make it very, very clear. And in fairness, the Prime Minister of Ethiopia, most senior UN officials, Ethiopian Human Rights Commission have all done so about sexual violence. The reality is on the ground, it is sadly, horrendously continuing.
I mean, James, the situation in that region, specifically, as you say, for women and children there, is one of so many facets. It's the protection of women and children in the region. It's an education emergency. It's a nutrition emergency. What happens now, aside from calls from the UN, from the various players to do what now needs to be done? You know, where to from here?
First and foremost, make sure that organisations like UNICEF have unfettered, safe access to reach people. You know, there's a lot of aid actors up there, NGOs, UN agencies, and I saw some pretty incredible, brave frontline work. UNICEF, my agency, is reaching more than 600,000 people with clean water. That's life-saving. We're doing the most severe types of malnutrition. Those women who are able to get to centres, you know, there are cash supports, dignity kits, medical care, legal care. But, Michelle, we do need that complete unfettered access. One of the amazing things I saw are these mobile nutrition health teams that UNICEF sets up, and they go out into, you know, really hairy places, but they make sure they are reaching people, mums and children who critically need support but cannot get to those health centres. All those health centres that I mentioned have been destroyed. But those health teams, we've had 15, 16 cases in the last couple of weeks of them being threatened by armed forces, you know, threatened guns to heads, leave this area and so on. So one, we need unfettered access to do our job. And two, of course, conflict has never been seen to be a solution. All parties need to sit down. We need days where there are moments for families to regroup, get back, enable them to plant. This, as you say, it's a nutrition crisis. They missed harvesting. This is planting season. Pretty good agriculture there, but not if you're in a camp of 50,000 people without any ability to fertilizers or water.
So, James, in the midst of the disaster that you're describing to us, how does COVID-19 and its impact make UNICEF and other humanitarian organizations make your job so much harder?
It's a great question. Obviously, COVID, you know, is there. In Addis Ababa, you know, every single person wears a mask. It's very clear and rule-orientated. I just don't think there are the masks right now. You have people in camps who previously were in rural areas and doing pretty well, I have to say, and now they're in these smaller areas, often schools again, so kids can't go to school because people are seeking refuge in them. They're unsanitary. We haven't been able to get the level of support that we would like to based on funding and security. It's impossible for people to follow COVID measures there. So it's a ticking time bomb when it comes to sanitation, be it cholera or COVID. It's very difficult, to be fair. It's extremely difficult on that population. And as we know, COVID is not going away. So the quicker we're able to get peace, to get people go back to their homes, which again means agencies like UNICEF rehabilitate those water systems that have been destroyed. If we can do that, get people back, then they have a chance, both in terms of nutrition, education, and this pandemic.
Such a disaster for children in that region, James. Over 1 million children out of school for more than a year now, over 13 months, we're told. To add to that, the numbers we're getting as at about a week ago, 3,000 unaccompanied and separated children also identified by UNICEF across that region. You know, what happens now and what is the job now of trying to get on with some kind of reunification process, if at all?
Yeah, it is one of the things UNICEF does very well. We are pretty advanced on how we reunify children now. We've been able to obviously, you know, embrace the digital age, and that can be really useful and can expedite things. Obviously, there's been telecommunication blackouts as well. There is no internet, for example. It makes it much more difficult. 3,000 children, again, is probably not a complete number. Numbers tend to be understated, Michelle. And again, each one, I've met some of these children, and again, they're brave and they're resourceful, and their communities help them because they fled fighting, but they've been separated from mum and dad, loved ones. And there's a level of anxiety there in a child, which is completely understandable, but also pretty heartbreaking. So when we know these children, we'll get them into safe places, we'll get them nutrition, and we start that long process. But again, children are becoming separated day after day, so long as the fighting continues.
Yeah. They're brave in ways they should not have to be. James Elder, that's all the time we have for this incredibly important discussion. He is with the United Nations Children Fund, in fact, having just returned from the Tigray region there in northern Ethiopia, where the conflict there continues. James, thanks very much for your time. We're told thousands of people believed to have been killed in that conflict, some 4.5 million people in need of urgent humanitarian assistance. And as James outlines the conflict there, women and children really at the brunt of some of the most horrific incidents of rape and sexual assaults taking place in that region. The Ethiopian government, for its part, says it is investigating these abuses taking place in the northern region of that country. Still to